Thanks.
Number one in the hand, spills it up. That watch me work when I get this, she picks it up and she go grab a couple tunes. They think we don't know more two more. Like, we don't know more two more. Like, got the brain going into different places with a mic in
V94.9 WATV. Welcome to the show. I am Lady Wu. Got my crew in the building. We're getting situated, y'all. A busy weekend. Everybody everywhere. So we're all coming in around the same time tonight. Welcome. Just welcome. It's the summertime. Y'all know in the summer it's a lot to do, a lot of places, a lot of events happening. I didn't get into like I'm a 2 o'clock this morning. So bear with us. Let me find this code so that you all can watch and listen for the hottest hour in health right here on V94.9 WATV. Who's in with us? Crew, who's here?
What's going on? It's your boy, Ready Eddie.
Attorney Christian.
Hey, it's your boy, Jay Hat.
All right, and we have our special guest, the ladies of MedsPlus Consulting in the building as well. You'll be able to see them shortly. You can see two of them right there. So what's hot in health? Every second Sunday right here, a new series by name, but we've done this before with the ladies. These are some of our friends who we can always chat with and check in with when it comes to what's hot in health. That's why it's called that. How y'all doing?
Doing wonderful. How are you?
Sleepy.
Hello,
I'm great.
Indeed.
So Dr. Jennifer and Pauline, welcome back. It's been a minute. And it's a lot going on in health. It's a lot that's hot in health. And I know that everybody's going to have questions and things to ask about because, I mean, our health is our wealth. It's who we are. It's us. It's everything about us. So I know that you all will have some questions. 994-8949 is the number so that you can be a part of the conversation. 994-8949 is the number. All right. So how have you all been? What's been happening at MedsPlus?
You know what? We have been amazing. Absolutely amazing. Today, we actually celebrated 10 amazing students who completed our pharmacy technician program.
Awesome.
They graduated through the Good Jobs Challenge, and we will be placing them in jobs soon. So we've had an amazing day.
Yes. Oh, well, congratulations to all of them and their new endeavors. I've been hearing about the good jobs and the new careers in healthcare. What are some of those jobs? What will they be doing?
Yeah, so we were able to train pharmacy technicians.
Okay.
So they went through about a 7 to 8 week course where they learned skills, medications, health conditions, to be able to assist pharmacists in filling prescriptions, whether it's in a community setting or in a hospital setting, long-term care. So we were getting them ready for the workforce.
Okay, awesome. I know people think that filling prescriptions is just simply putting the pill in the thing. Yeah, like count out 30 and put it in there, right? No, it's more to it.
No, it's much more.
It's got to be more to it, right?
Absolutely. We do not go to school the length of time that we do just to do that. So if you think about it, it is a personalized thing that we do. So that's why it's always important to go to the same pharmacy. And we're looking at medications you're currently taking, health conditions that you have, so that when the doctor prescribes something new, it's not a drug interaction. It's not an interaction with the health condition you may have. Making sure the prescription is written correctly.
Okay.
Making sure it's for the right person. Making sure you don't have an allergy to a component in the medication. So there's a lot that goes into it. Yes, we do have computers and they help. But at the end of the day, we are the final check and we need to be able to have that education to do that.
I know that's right. Okay. So MedsPlus Consulting, you all do more than prescriptions, though. There's some consulting in there. What does that consist of?
Absolutely. So we are a full service healthcare consulting company. And that means that we work with patients, we work with their caregivers, we work with healthcare providers. So your doctors, your physician assistants, your nurse practitioners. We also work with employer groups. And the main goal in that is to improve health outcomes.
Okay.
Dr. Jennifer and I both come from big box pharmacy. You're looking at almost 45 years combined pharmacy experience between the two of us. And through that, we've just seen areas where people were doing the right thing. They're going to their doctor, they're getting their prescriptions, they're taking them to the pharmacy, getting them filled. But for some reason, their outcomes haven't improved. They still are struggling with depression, hypertension, diabetes, and not meeting those goals. So we actually started our consulting company to be able to partner with all of those different groups so that we can improve those healthcare outcomes.
Love it. Okay, so there are a lot of things happening, you guys. MedsPlus Consulting, they know what they're talking about, what they're doing, how to help you, and you should check them out. Like when we first met, I was like, I'm gonna switch all of my stuff over, and I did that. And a lot of people are making that switch. So you that are listening, and you still going to the big box pharmacists and pharmacies, which are closing down. We're gonna talk about that too. You might want to go ahead and switch. Go ahead and switch to some people that look like you know, kind of know, they know. Okay.
So tell them what's been your experience, the MedsPlus experience.
I've had several different experiences. So all of them have been great. For one, the one that stands out is that y'all brought them to me one time. I said, oh no, this is great. I don't have to get out. I don't have to do anything but this is great. So the delivery service is good. Another thing, I didn't have to ask for refills. Like you all were on top of that. That was good because you'll let time pass and you need something and it's not there, but you have one refill ready. Of what? Thank you. This is great. I didn't even know I needed that. So that's the other one. Those are the top two for me. But just the fact that I don't have to it's just easy. It's easy. So I really appreciate that. And that's why I want y'all to switch. Like, it's just easy. And then these are our sisters that are amazing with what they do. So just switch. It's just simple as that. So what are some programs that you all have going? And then we're going to get into all of our questions. Anything that's happening right now.
So I'll just piggyback on what Pauline mentioned. So when we talked about working with people with diabetes, we do have community-based diabetes education.
Okay.
We just finished our cohort for the year, the first one, and we'll be starting our second one June 17th.
Okay.
They will be held every other Tuesday in Ensley. So we're going to different parts of the city. We just left North Birmingham. So we'll be in Ensley. We're going to be at Renew Birmingham. It's on Avenue H in Ensley.
Okay.
That class is going to be held from 5 p.m. to 7 p.m. We're doing it different because now we're trying to catch people that work during the day that have not been able to attend our other classes.
Okay.
Requirements. You have type 2 diabetes. When you come to the first class, we're going to do a screening. You're going to know what your A1C, your blood pressure, your weight, and your full cholesterol count. Now, where can you go and get that? We're going to do that. We're going to give you a blood pressure monitor as well as a glucometer and enroll you in our RPM program.
Okay.
So what does RPM stand for?
You already know what I'm saying. Okay.
It stands for remote patient monitoring. We will have the ability to see what your readings are. So if we see things that are kind of going the wrong way, you'll get a phone call from us. If you're doing great, you will be celebrated. If something is off, we'll be able to reach out to you to address and or do that in class. Okay. So we have 7 healthy topics that we discuss. So at the end of the program, we'll do the screenings all over again because we want to be able to show you how your behaviors are tied to your clinical numbers. Behaviors tied to your clinical numbers.
So what you eat, what you do, maybe even how you think, so all of that.
You better say that.
Okay.
Because we do have a topic on healthy coping. There is a thing called diabetes distress. Because of all the decisions you have to make sure you're making the right decision, it stresses you out. Also, people or family members of people with diabetes, they really don't know how to support the person with diabetes. You know why? Because they always want to fuss. They always want to be the food police. And what that does is turns them into doing the wrong thing even more. So we kind of talk about that. A lady shared a powerful story about her daughter was sick, so she made her a healthy batch of soup. And the daughter told the sister, Mama didn't make that soup like she did the last time. It tasted different, but it was a healthier version. And it hurt the mama's feelings because she thought the daughter would be okay with it to support that she's making healthier choices. So not only does the person with diabetes need education, their family members do too.
Yeah, or they need to learn how to cook, one or the other.
We go through all the things, and once we wrap it up, tie it up, we do a graduation, we do line dancing, we have all the fun.
Okay, I like it. So how can people sign up again?
So what you can do is go to our website at MedsPlusConsulting.com, MedsPlusConsulting.com, MEDSPLUS Consulting.com, or give us a call 205-650-4636, or you can message us on our Facebook page. We're on all the social media.
Awesome. MedsPlusConsulting.com, and then the phone number again.
205-650-4636.
All right. So boom, if you are living with and learning about diabetes, this is for you and family members as well. Anybody that needs to know, and I know that's something that we in our community are plagued with for various reasons. So, like type 1 is hereditary, type 2 is onset, later onset. How does that happen?
Type 2 onset happens later based on your lifestyle choices.
Okay.
Well, I was going to say, so type 1 is basically, we think it has an autoimmune effect. So basically your pancreas doesn't make insulin anymore. And so you have to use insulin. So we call people with type 1 diabetes insulin dependent. They require insulin.
Okay.
Type 2, we used to call it adult onset, years ago, but there are a lot of younger people, children, especially post-pandemic, who have been diagnosed with type 2 diabetes. And people with type 2 diabetes, they don't require insulin. A lot of them, use insulin, but they don't require it. They can treat it with lifestyle changes. They can treat it with additional medications, but they don't require insulin. So that's an easy way to kind of differentiate the two.
Okay.
1 requires insulin, 2 does not.
One of my good friends got an adult diagnosis of diabetes and switched some things up. So before we get into that piece of the conversation, I want to talk about Ozempic. So, here lately, I may have gained about 4 pounds. And reason being, I'm just not, that's how I be like 4 pounds. But when I pick it up, I feel it. Okay. And that's how it goes over in these genes. But one day I thought about it. I was like, what if I had some Ozempic like everybody else? What would that do? How fast would it work? How small would I be if I just did it one time? It was so soft.
I know. Yeah. So first of all, when we talk about Ozempic,
let's talk about it.
Yes, let's talk about it. Ozempic is a medication that is FDA used to treat diabetes. So when we talk about weight loss, we don't want to use the brand name Ozempic because it is used to treat diabetes.
Okay.
Now, the active ingredient in Ozempic is semaglutide. That is the same active ingredient that's in Wegovy. Wegovy is the Ozempic for weight loss.
So it's 2 different, because I've heard about that one too. So it's 2 different drugs.
It's the same drug.
Okay.
It's just 2 different brand names.
Oh, okay.
Ozempic it's the same exact ingredient.
Okay.
Ozempic is for diabetes. Wegovy is for obesity.
Gotcha.
But
Obesity.
For all intents and purposes, Wegovy would treat diabetes the same way that Ozempic would. They're just 2 different names.
Correct.
Same thing.
Yes, it's the exact same thing that's in it, but it's like when you get Tylenol from Walmart and get the Equate brand, and then you may go to the Dollar Tree. They're all acetaminophen. It's just 2 different brands.
Okay. Good to know. So basically, for 4 pounds, you shouldn't be trying to use no Wegovy.
Correct. So with semaglutide, it's important to note that it is used to treat the condition of obesity. And when we talk about obesity, we're talking about people who have a body mass index of 30 or above. And so that's important to know. The BMI is a simple calculation. There are calculators all over the internet, but you put in your weight, you put in your height, and it gives you your body mass index. Now, we know that there are some challenges with BMI. They're actually looking at different ways to classify obesity, but right now we're using BMI.
Okay.
So if your BMI is 30 or higher, when you put it in that online calculator, you are considered obese. And for those people, you may want to talk to your doctor about going on a weight loss medication, whether it's semaglutide, which is Wegovy, or tirzepatide, which is the brand name of Zepbound.
Okay.
So it's a pretty easy prescription. Some insurance plans pay for it, some don't. So it's important to note that, it's not for people who need to lose 5 or 10 pounds because they have an event coming up and they want to fit into a dress. It is actually used to treat the health condition of obesity.
Gotcha. Okay. So, because y'all know this is like trend. Like now, I don't know how people use it. So like, I don't know not to say that you need to tell them, but if people are buying it from somebody, and is it like a 1-dose thing and it works for 30 days, or like, how does it work?
Yeah, so the way it works is you start off at the lowest dose. Typically, people will start off at the lowest dose because there are potential side effects with any medication that you take. There are potential side effects. There are things that may happen that, we're not prepared for. So you definitely want to start off at the lowest dose, and it's injected once a week. So you take your injection once a week, the same time each week. And then as you get accustomed to that dose, you're not noticing side effects, then you may want to go up to the next dose. Typically for semaglutide, we're noticing that most people see the appetite suppression, they're, avoiding certain foods at about anywhere from 1 milligram to 1.7 milligrams a week.
Okay.
So that's probably the 3rd or 4th strength from the lowest dose. So it takes some time to start seeing the appetite suppression so that you eat less and therefore lose weight. The good thing about semaglutide and tirzepatide is that they both also kind of cut down the food noise. So one of the things that people who are obese, say is, I'll be eating lunch, already thinking about what I want for dinner, or I have just finished lunch and I'm like, well, I feel like I want something sweet. That's like
my goodness, like I need you to think about something else. So that's what the medicine says.
Right, exactly.
I need you to be thinking about.
Yes, it's like, let's turn down this food noise.
Okay.
Let's turn down that conversation in your head so you can focus on something else.
Okay.
And that's the beauty of the drug. I mean, there have been billions of dollars spent in research and development to work on something like this. Obesity is a problem that's been growing over decades, primarily due to our food supply and our sedentary lifestyles. And because of that, pharmaceutical companies have been looking for a solution, and these drugs have come out on the market and done extremely, extremely well.
Okay. See, I told you I didn't know what they're talking about. So, Eddie, you want to jump in?
I'm the friend she was talking about. Yep.
Eddie, can I get some of your Ozempic?
That's me. Well, so in November, I ended up with a blood glucose of like 426 and then spent 24 hours in the hospital.
Wow.
And they gave me insulin when I left, but I changed my diet drastically. I lost 30 pounds before I got to the doctor to even get Ozempic. And I lost those 30 pounds. And when I took Ozempic, I ain't lose nothing.
You ain't tell me that.
I ain't lose nothing. Wow. I didn't take the Ozempic until I lost 30 pounds, and then
that was it.
But I only had a sample. Okay. It was like I was just gonna take it back 6 weeks, and then I was like, I don't have to take it after that. I felt some very small effects. It felt like, so it impacted the portion size I desired to eat. And it felt like most of the time, it felt like I was just, every time I ate, it felt like I just ate it. I'm in a constant state of feeling like I just ate enough. Okay. Or just ate a little snack that get you just good enough to not needing food.
But were you still thinking like, dang, I'm still hungry? Or did it change the way you thought about that?
Food wasn't as interesting to me as it was before, lightly. And then after 4 weeks, it went up to like a 0.5 milligram.
Yes.
And then it strengthened that a little bit. It was like, well, I don't really care about food. But that 6 weeks helped me manage my portions that I've been able to keep up with. Okay. My doctor was like, hey, even if you only gonna take the sample, depending on if your insurance will pay for more or not, if you want to take more or not, because she was like, well, your diet changes, you may be on the path to not needing medication. She was like, it can help you create new patterns, and it has helped me create new patterns, and I've been able to keep in new patterns.
Okay.
Yeah.
I just want to add, Eddie, you brought up two really good things. The first is when you had your blood sugar, it was in the 400s. A lot of times that's when people first get diagnosed. Something happens, it gets them to the doctor, to the hospital, they're having complications, and then they'll ask them, how long have you had type 2? They're like, I don't have type 2. Well, yeah, you do. So that's where we really, really encourage people with preventative screenings. A1C is the gold standard for whether you're normal, you have pre-diabetes, which that is a diagnosis. That used to be called borderline sugar, but it is pre-diabetes. There's a range for that. Then there's a range for type 2 diabetes. The other conversation that comes up is, okay, I have diabetes, but then I take my A1C, my numbers have fallen. So I try to get people to understand that it's just like when you've been diagnosed with cancer, you take chemo, you test again, it's in remission. So for diabetes, you have to continue to check your numbers and make sure you're not tipping over into type 2. So now when that number is below that, now you're a well-controlled person with type 2 diabetes. The second thing I wanted to tap on to what you said is what I try to get people, encourage people to understand is that if we eat lesser portions, we will still live. We have trained our brains, our bodies to think more is what we need. Then the food industry, when the buffets came out, oh, I'm going to get my money's worth.
Yeah.
We started overeating. So what happened? The stomach just stretched and stretched. We started to have this poor relationship with food. Then we use food as medicine. Oh, I've broken up with someone, had a bad day. You would always talk about how if you had a bad day at the big box chain, you would get you some donuts, you know, things like that. So we have an improper relationship with food. That helps to quiet the food noise and realize, you know, this is all I need. And it helps you to try other things you may not have otherwise tried, because now you're not craving grease, overly fat or overly seasoned food, carbs, all the things. I can just sit and watch Netflix without a bowl of something next to me. So it kind of retrains you if you pay attention, so that if you decide you want to continue as you have decided not to take it, how to be able to maintain that loss that you have. Because obesity is a chronic condition, just like hypertension, just like diabetes. If we don't manage it, the pounds are going to creep up. That's where that term yo-yo dieting comes from. It's a chronic condition. It's not because people are lazy, because they don't want to exercise. There's some clicks and some switches we got to turn on and off so that we can better manage ourselves and our relationship with food.
Thank you for that. And I was going to ask that about Wegovy and Ozempic, just the connections that Eddie was making about the thoughts about food and how we think about it. Kind of sounds mental health-ish, psychotropic to me. Psychotropic. Like
it is. And
it's something there.
And so much so with our weight loss program that we have mental health therapists, one in particular, who works with people as it relates to weight loss because they've been through the journey. And I think that that's very important too, because you may start off gung-ho and ready to do, but then, you know, those things, I tell people it's psychological as well as physiological changes that are happening at the same time. And I remember when I first did a weight loss, this was before the injectables, I always went to my old size until I went to the dressing room and realized this is way too big. Then I went to the other size, still wasn't small enough. I was scared to get the size that I should have been in that fit right.
So that was the mental piece.
That was the mental piece.
Okay.
So by the time I realized I had lost as much weight as I lost, I just couldn't wear my belts. I be wearing jogging pants all the time. So when I finally needed to wear my belts, they was just all too big.
You got to put no hole in it.
I did. So the night I went with Woo that night to the city club or something like that, and I had to put on my suspenders that I didn't plan on wearing because I was like, this the only way I'm gonna be able to wear these things.
I gotta wear these pants.
Yeah.
I didn't know. I didn't know I was this slim now.
Now, one thing that I learned was that I was consuming all of my carbs and sodas. That's most of my carbs and big portions of starches. And so for me, I mean, I'm a big guy. I do like a big plate, but I was shifting the size of the portion. So I was shifting to more fibers. So carrot, broccoli, and asparagus with a piece of fish with a very small portion of rice if I had any rice. I cut everything white out of my diet. No white sugar. I changed that to natural sweeteners with monk fruit sweetener and stevia. Then no more white rice. The only time I eat any rice now is Chipotle brown rice because you can actually go on their website and look up exactly how much carb, protein, and fats that it have. I started learning that like eating all of those things together is much improves your blood glucose, how high it goes up, how fast it goes.
Like a bowl or something.
Well, if you just eat carbs, your number's gonna go up faster than if you eat carbs and a protein and a healthy fat like avocado or guacamole or something like that.
Yeah, we talk about the glycemic index of foods, and that's what you're talking about. It's the ability of the food to raise your blood sugar. And there are some really high glycemic index foods, and the way you kind of mitigate the increase in your blood sugar is you combine it with things like fiber and protein. So one of the things when people are making lifestyle changes, the first thing they do, well, I stopped eating breakfast and now I just have an apple or a banana. That's the worst thing that you can do because what you're doing is just
like,
eating your body sugar. Those are relatively high glycemic foods. Your blood sugar is going to go up, it's going to crash down, and you're going to be starving. And so for lunch, you're going to have a 5-piece chicken wing basket with ranch fries and
I gotta make up. I'm starving.
Right. But that's what's happening. It's because you're starving yourself. Everybody, we need breakfast. We have to have it because, and there are people that fast and intermittent fasting. That's definitely a thing. But for the average person, we need breakfast because we've been fasting for 6-8 hours, and then we have to fuel our bodies, and we don't want to fuel it with pure sugar that's in things like fruit or fruit juice and things like that. But I love you mentioning your story, Eddie, because you are the patient, the person we're trying to reach at MedsPlus. I don't know what your relationship with your healthcare provider was like before you got diagnosed, but I love for you to talk about what you kind of went through before your diagnosis and then what your relationship with your healthcare provider is now like after your diagnosis.
Okay, so when all this happened, I didn't have insurance. It was November. I was waiting to January to get my insurance reinstated. So physically, I didn't have any physical body issues. What happened was I was doing a podcast at a church that morning, and there was a TV screen in the back. And I was like, I should be able to read that, but I can't read that. And so I went to, I called a nurse friend and she said, you need to go get you a blood glucose test at Walgreens. That's when I saw it was 426. I called her like, I'm going to the hospital. So I went to the hospital, 24 hours. They got my numbers down. I was real confused about what to do, about what to eat. And so really I was just like, look, I'm just going to cut everything out. Everything that they told me is unhealthy. So I'm cutting everything white out. They told me that I'm lucky that I actually like vegetables and fish and things because like people who don't like vegetables really struggle in a moment like this. And so I was like, I love me some vegetables. I eat vegetables with a little piece of meat. And I'm not a bread person and I can do without starches as far as rice and grits and those things go. So it was easy to make that transition. From that, what I learned was the reason what happens when your eye vision starts to get blurry, that sugar can be eating on the nerve endings in your eyes. And so I went to the eye doctor. The eye doctor said, we see no damage, no indicator of anything. So I'm like, okay, we good, but you don't find out until, because you hear people with diabetes and, stuff about their feet.
Yeah.
I rarely hear about eyes, but I always hear about feet. And I was like, I didn't know that it's impacting all of this stuff.
I heard about eyes first, like the blurry vision.
Number one cause of blindness in America, type 2 diabetes.
Okay, the number one
cause.
Yeah, and you bring up so many things that we want to stress. I mean, I'm just like, but number one is preventive care.
Okay.
Because and you know, you saw us at a lot of events.
I was gonna mention that.
Let's
I was
talk.
gonna mention that.
Did he
We were, and I don't know that we ever did a screening.
No, you have done a screening.
Okay.
8 months before that, my last screening was 8 months. Y'all tried to get me to do like 2 more in between that time. But the one that I did that 8 months before, you know, was good.
Okay.
You know, so between then I did have COVID. And my friend was saying that with COVID, they seeing really unpredictable stuff, stuff that wouldn't normally happen, is just showing up for people.
Yeah.
And so I don't know what the variable is, but you know, I can't help but go back and be like, dang, if them other 2 times they would have asked me to go and get that A1C check, would that have intervened or maybe not? I don't know.
Yeah.
You know, but that's the part of that journey too. As far as like, and I found a doctor, and the doctor was real cool. She said, you don't have insurance. What I'm gonna do is we're not gonna worry about charging you this. I ain't gonna tell you who it is. But she was basically saying the fact that it happened so close to you getting insurance means that if the first thing you do on insurance is get prescribed something, they're gonna just assume that you've been waiting to get that insurance, and they're gonna be more likely to turn it down. So I'll prescribe it to you now, so that there'll be a past record of you getting it, so that when you actually come back here with insurance, it'll be less likely that they deny it. And so just to see that there are doctors who know the system well enough to be like, hey, I want you to know this is what you're gonna have to navigate. That was helpful. I didn't know about continuous glucose monitors, right? So when I got it, I pricked my finger the first time. I was like, you know what, this ain't so bad. After about 4 weeks of doing that, I don't want to do that no more. So I've had a continuous glucose monitor the whole time. And they have over-the-counter ones now. Like this happened like right within the same year this happened was when they released over-the-counter ones, where they actually denied the one that would have been prescribed to me by my doctor. And so I'm using the ones that are not. And the ones that are not cost the same as the ones that I would be paying my copay for anyway.
And you talking about the one that you stick on the back of your arm?
Yeah, you stick it on your arm. I got mine in my thigh, because that's where I get the best readings, because it doesn't read the blood like just the same way that, you know, a prick does. It reads the fluids between the blood that the blood leaks into.
Yeah, it's the interstitial fluid.
Yeah, the interstitial fluid, it leaks into that, and it reads that. So it's not always 100% accurate. And sometimes but when you put it in, you do like you put it in and then you read your numbers, so it'll kind of like give you okay, it's gonna be 15. Yeah, the calibration, it'll be like, okay, clearly this one gonna be 15 over, but it's different from time to time. I mean, I don't listen to no variables.
I like the way this conversation is going. So he's telling the story, you all are telling the medical terms. He's saying, yeah, because that stuff was like this, you're like calibration, and then them numbers were saying this and that data. Okay, this is it. This is where you learn, people. 994-8949 if you're someone dealing with this, or like I know that Eddie is very detailed about what he's experiencing, but there's somebody else that may have a diagnosis that has no clue what to do, what to take, what the symptoms are. With it, I'm just living, still eating whatever they want, however they want. I want to go back to the pre-diabetes. How and what?
Yeah, so pre-diabetes essentially means that your A1C, which is that number we talked about, that gives us your average blood sugars over the last 69 days. Okay. Pre-diabetes means your A1C is not high enough to diagnose you with diabetes. So it's not 6.5 or higher, but it's not low enough that you're normal. So it's 5.7 to 6.4 is the range. And if your A1C is within that range, you have pre-diabetes. What that means is you can make lifestyle changes now and hopefully go back the other way to a normal blood sugar. Okay. There are some doctors, depending on your comorbid health conditions and your family history, that may prescribe medicine to someone who has pre-diabetes. But for the most part, we recommend lifestyle behavioral changes, everything that Eddie talked about. And the thing that I want to point out there is, Eddie, you are very disciplined. We've spoken with you before, and you love vegetables and things like that, so you can cut that out and not really feel anything. But there are some people who can't make that 180 with their lifestyle. They need to make more small, sustainable changes. So you talked about realizing that you were getting your sugar and calories in your beverages, things like that. So if you're drinking 20-ounce drinks, and I always tell the story of me, I used to thrive off of sweet tea. I love sweet tea because I don't drink coffee and things like that. So that's what gives me my little buzz. But I had to learn to, I can't drink a 32-ounce sweet tea every day, even though I would like to. I can't do that. So it's about making small, sustainable changes that will hopefully help you transition back to a normal A1C, which means your average blood sugars are normal, as opposed to going the other way to diabetes.
And another thing, when we talk about pre-diabetes, I want to talk a minute about what's physiologically happening to us. There's a term called insulin resistance. So when you asked about, the difference between type 1 and type 2, the process begins with insulin resistance. So when we talk about our blood sugar, when we eat, the pancreas releases insulin. Insulin is the key to unlock the receptor on the cells to allow the blood sugar to go into the cells where it's needed.
And see, that right there is why folks just be doing whatever. Because what?
You say, what did you just say?
Right. So you tell I got diabetes, and you tell me that in the cell unlocks the sugar and the what? Okay, can I get that cookie, please? Because what?
So when we think about what we eat, right? The reason we're eating is number one, nutrition, number two, energy. So in order to have the energy, what we learned in biology in 7th grade, that the mitochondria in the cell is the powerhouse.
I kind of I do. Okay.
So now we think about getting the sugar to where it needs to be to do the work that needs to be done for you overall to be to have energy.
Okay.
So now that insulin is going to the key outside the door of the cell, and it's like insulin opening the door, the sugar after you've eaten, okay, sugar, get out of the bloodstream and go into the cell. What's happening is, you can look at it two ways. Some people call it lazy insulin, or you can say the key is no longer working.
Okay.
So now the blood sugar the sugar is staying in the bloodstream and not in the cell. So now when we take a reading, the blood sugar is elevated. Another way they can take a look at insulin resistance is if your insulin levels are high. So that means your insulin is like, okay, so we eating, we snacking. Okay. Wait. Okay, here comes the insulin, and then insulin comes, it doesn't get the sugar in, sugar's still out there. Then you go eat again. Insulin come again, the sugar's still out there because the key's not working. So now you're going to have hyperglycemia and hyperinsulinemia, which is high insulin levels. So that's another way to be diagnostic as well. So as we talked about earlier, it's important to get up in the morning to eat breakfast and for it to be balanced. So versus just drinking orange juice and coffee and a croissant. Now you got sugar, complex carbs, simple carbs, and sugar. So now you're spiking. Now your insulin and your pancreas is having to work overtime to get that in. When do you eat protein? Probably at lunch, probably at dinner, but then you're still not, if you're not eating a balanced meal and you're snacking a lot, now your insulin isn't going into overdrive. It's having to produce more, and it's just getting tired over time. It's like, give me a break, let me rest.
Okay.
Let me stay up all night. Let me eat snacks. So insulin is still pumping out, doing what it does. So then 20, 30 years later, we look up and we wonder why we may have type 2. That's the scenario of what's happening behind the scenes, insulin resistance.
Okay, that was a good breakdown. 994-8949 is the number you're listening to our doctors from MedsPlus Consulting. You can go to their website right now, MedsPlusConsulting.com. You can also give them a call at, what's the number?
205-650-4636.
And it's also posted if you're watching, but you can hear it now and share the information. So right now we're having the diabetes discussion, but there's so many other things to talk about what's hot in health. So I do want to keep us moving, but we can revisit this. But before we move on, if someone wants to know those levels and how to get into some type of treatment, can they come to you offer that?
Absolutely. And that's the thing we want to say for people, especially like in Eddie's situation where you did not have insurance, we can do a full panel at our office. Our office is downtown Birmingham. So we can check your A1C. We can do a full cholesterol panel and your blood pressure. And that gives you a basic idea of your overall health. Those are things that many doctors do at your well visits or your preventive care visits at your doctor's office. We are able to do those in the pharmacy. So if you're in a situation where maybe you don't have insurance, or you have a high deductible plan, or you don't have a primary care provider, Because one of the things we're seeing in the community is if you don't have a PCP and you call somebody right now, it may be 6 or 8 months before you get an appointment.
Yeah.
And you kind of want to know where you are. You're listening to this and you're like, I need to know where I am
Mhm.
because my grandma had diabetes, or my brother or sister has diabetes, or someone passed away because of complications, and you want to know where you are. Give us a call and we can do a screening for you and kind of let you know. And if you need a provider, we can help get you in the door with one in case you need treatment.
Sounds
And
good.
I'm gonna suggest a few things.
Okay.
Be very wary because my daddy got type 2 diabetes and my grandmama got type 2 diabetes.
Mhm.
Both of them are very mild, so mine has turned out to be mild. So if you got parents and grandparents that got diabetes, start checking in on your health. The other thing is the journey of learning what food does to my blood glucose has been very intriguing. I would encourage anybody to get one of them over-the-counter Stelos and check that out. They last 15 days. It's a continuous glucose monitor. It look intimidating. It don't feel like nothing to put on, but you get to see what food does to your body. For example, the difference between what minute oats do to my body versus steel cut oats is ridiculous. Then just because of bread, say wheat bread, it's processed, it's very processed. They do a lot to it, and it don't aid in the natural absorption of the food. It's an unnatural absorption, and it just speeds it up so fast. Another thing is like, just because something say wheat bread and it brown don't mean it is healthy. And so looking at the back of them packages, it's just the amount that I've had to educate myself about what's food doing has been very, very helpful. And then the last piece I'm gonna say for me is cutting off all of that stuff was just to figure out where my norm would be. Okay. It gave me just enough time to see, okay, so let's see if I cook my cornbread with wheat bread, what the difference is with wheat flour versus with regular flour. And then I tested to see what it do to my numbers, and I was like, okay, I can do this.
And not enriched.
Yeah.
Not enriched, not, but I'm saying all this, but I got a cheeseburger and 6 wings waiting in the truck. And the fries. I started eating the fries on my way in.
At this point, I can eat a cheeseburger and fries. I know what they do to my numbers.
Yeah.
I just can't have.
Right. Look.
Well, it's about knowing how much I can eat before it starts spiking me to the point that like my insulin finna have to work overtime. But because of that, I don't be eating burgers like that. But if I eat a burger, it's something that I plan for a 2-day spread of what I'm eating versus just I'm not like playing like I can have me a burger every day. And it's more so like I'll have the things I want to have when I feel like I need to have them. Outside of that, I've just navigated towards what the sweet spot is and what I eat. Because a lot of the things that I was eating that I felt like were necessary, like wheat bread, avocado toast in the morning with the wheatiest wheat bread you can find is still delicious. Mm-hmm. It don't have to be white butter bread.
Avocado toast.
It's so good. It's so good. Avocados are good.
Yeah, I like guacamole, but I don't want it on no bread. But let's talk about something else.
That's why this is a personal journey. And Eddie is absolutely
Let's go
right.
eat avocado toast.
Yeah, no, I know.
Turkey bacon.
But Eddie is right. It's a personal journey, and I second that emotion as far as wearing the CGM. We were able to wear it, and again, neither one of us has diabetes, but we were able to wear it, and to see what certain foods do to your blood sugar, you will be amazed. And I like to tell our patients with diabetes, it's like Big Brother watching. So, when you have to, and it's even when we write down what we eat or use MyFitnessPal or those apps, when you have to put it in, you're like, ooh, do I really want this? That's kind of what wearing a CGM makes you feel. Like it really makes you be aware of what you're eating, makes you aware of the calories and the sugars. So you make some better decisions.
Okay.
And what I found out when I wore it was that I didn't eat enough. And so I still go back to where when you talk to most women, oh, I don't eat that much. You're right. You don't. You're not getting nutritious foods. So your body is holding on to what you do give it. Mm-hmm. So now you're not seeing the difference on the scale. But then once you learn to combine the right foods together at the right times, and that you're making sure that it's nutritious, then you'll start to see a difference. And of course, we have to add the move component in there as well, or exercise.
Okay. All right. We're learning a lot. Like I said, there's so much to talk about, but we'll be doing this monthly because there's so much to talk about. Eddie, I know you and I have been paying attention to the human the human services system and what's happening with human services. And I know the rest of the world has too. I've been paying particular attention because of the studies that I'm doing, and I'm trying to make it make sense so that I can have a job or create a job in my new field of work. So health and human services, RFK, y'all. Okay, they laughed. Everybody laughed. So that says a lot. That's why I need to make sure that we're on point with this. So what was the first thing? I know vaccinations and
I mean, I kind of from your perspective, I kind of wanted to know what should we be doing to prepare ourselves for the anti-vax sentiment. Even seeing that measles in Texas is starting to spread around because of that same anti-vax sentiment. Is there anything we can be doing to prepare ourselves or educate ourselves from y'all's perspective? What should we be focusing on in this moment in our political climate?
Yeah, I'd say I have two things to focus on. One is your baseline health, and it's exactly what we've talked about for the last 45 minutes. Making sure that your body is in the best position possible so that if we have another COVID-19, our body, our natural immune system is able to fight off because we've given it the nutrition and what it needs to work at its optimal level.
Mhm.
I think the second thing is because we're in, I hate to be like fear mongering, but we're at a point where if, the federal government says that, certain people shouldn't receive vaccines, what that will do is that goes down to the insurance companies and, CMS and people that pay for these vaccines. So now we fought so long for vaccines to be free of charge because it's considered preventive care. What we're coming into is a situation where if the feds say, right now, for instance, let me use shingles as an example. Shingles is a virus that lives inside of most of us who have had chickenpox as a child. The virus is still there. As we get older, maybe have stressful situations, that virus comes out in the form of shingles. So up until maybe 5 years ago, we had people paying $150 to get the vaccine or more to get the vaccine to help prevent shingles. And because of legislation and things that went on, now that is considered part of preventive care, so you don't pay for vaccines. If the feds decide that, they're anti-vax, if they take that position and certain vaccines that we're accustomed to, hepatitis B, varicella, that have prevented, when was the last time y'all heard of a kid with chickenpox? All of us had it. Most people in their 40s, you had it, your cousins, your parents would even bring you in the house with somebody with chickenpox to make sure you got it because you would be immune after that. Well, we haven't heard of kids having chickenpox because of the vaccines. Same thing with measles. And I actually got a headline earlier today that there may be a potential case of measles in Alabama.
Here they come with the mess.
Right. So they decide that, vaccines aren't important or they don't want to cover it. Your insurance company can say, okay, the federal government said that you don't need this vaccine, so we're not going to cover it. And if you decide to get it, you may be out of $150, $200. So those are the two most important things from my perspective.
And we have to remember the feds. That's
what
CMS guidance comes from. CMS covers our seniors that are on Medicare, and a lot of them in Medicaid, and a lot of them live in senior centers, so they're in close proximity. So what if they one day said we're not going to cover vaccines? It's going to be a terrible, terrible day at the senior center, in the nursing home, etc. So what I would add to that is definitely talk to your pharmacist, call us at MedsPlus. We can take a look at your age. We can also take a look at the state registry to see if you've received the necessary vaccines for your age, and then we can take care of that. Also, this upcoming flu season or respiratory virus season, make sure you're in line to get your flu shot and your COVID shot. As far as we know right now, the manufacturers are updating the formulations as they do every year, so they should be available this fall. The best time to get it, September, October, that type of thing, but whatever you do, make sure you get it. If you had a reaction to the flu vaccine in the 10 years or more ago, the vaccines are a lot better manufactured now, and most people are not seeing those same reactions before. So definitely reconsider getting the flu vaccine, whether you've had it or have not had it before in the past, because we don't miss things until they're gone.
Yeah. So the booster shots, like we stopped hearing about the boosters for COVID. I hadn't heard anything else about any of that. Have y'all?
Yeah, and it's kind of different. So the last thing I read, ACIP, which is the federal organization that kind of makes recommendations to the CDC, they were saying that it's possible that when the new COVID-19 vaccines come out in the fall, they're only going to recommend them for people age 65 and older. And that's actually a good thing, because what that means is when COVID hit the first time, our bodies weren't accustomed to it. It didn't know what to do. That's why so many people passed away. Our bodies just go into that inflammatory process and things go haywire. And that's what happened. But because of herd immunity, because of people getting vaccinated, and because of exposure, people getting COVID, and our bodies now have the antibodies and know what to do. There's a recommendation or possible recommendation that it's only going to be recommended for people age 65 and older. Okay. And that's just people who are high risk. Okay. So that hasn't been finalized yet, but just keep an eye on it, and we'll keep things posted on our social media channels. But right now it's looking like 65 and older for COVID-19 vaccines. Gotcha.
Miss Regina said, I never had any of these childhood diseases nor the flu. Healthy immune system. I mean, if you ain't ever had chicken pox or the flu or COVID or what else we used to have? Strep throat.
But y'all
didn't have measles and mumps. You had measles.
Measles and chicken pox.
Why you had me? You ain't that old.
I ain't gonna tell you no lie.
You had measles.
And I had chicken pox. I had chicken pox twice.
Okay, I remember I had chicken pox once. I remember my grandma put me in an oatmeal bath.
Measles when I was really little.
And that's what these swell right here, right? Mm-hmm. What is it that swells?
Your glands.
Oh, it's just the glands. And then they tie up a sock around there and have it over your head. Did they do that to you? Tonsillectomies and adenoids and all. We used to have a lot of stuff going on.
But you know what I'll say about Regina? The only thing that concerns me with the fact that she hadn't been exposed to any of this stuff, either through exposure to the viruses and bacteria or through vaccination, is as we get older, our immune system declines. Mm-hmm. That's one of the reasons why COVID may be for 65 and older. Our immune system declines. And when that happens, our body has a more pronounced reaction to the virus. So where someone that's in their 30s or 40s, your inflammatory responses go into effect, your immune system goes into effect, and it's able to fight it. As you get older, that effect is kind of dampened. It's kind of lower. So if I were her, I would, as she gets older, I don't know how old she is, but I would definitely consider vaccinations, because for someone who's never had the flu, and if they get it at age 68, 70, it has the potential to be detrimental.
Okay. All right. Thank you for that. What else, y'all? Like, it's so many things. I will say this. I know it's Men's Health Month, and we only have a few minutes left. But Men's Health Month, Men's Mental Health Month. Before we get into that part of it, just the men's health. Men, don't be healthy. Say it like that. They don't be healthy. Mm-mm.
So we have two men on the panel.
They might be a little healthy.
And one of the things that I've been trying to find the answer to the question is why avoiding doctors' appointments.
I'm so glad you brought this up. For our Men's Day last year at the church, we actually brought in Dr. Carter.
That's out to Dr. Carter.
And we did a men's thing for our Men's Day. And I'm happy to report that many of the guys went ahead and got checked. A lot of times, guys are just more like that Superman complex. And the trust factor with doctors and medicine, I think, is raised. But we even address that because a lot of people don't understand the Tuskegee experiment wasn't about them giving them it was about them
withholding.
Syphilis, I'm sorry, but withholding the medicine
treatment.
So I think miseducation is one, but I think two is just that guys just think that they're on top of the world, and so until our bodies show us that we're not.
I think that one first, before even before. What in the world did he? It went straight to DD. Let me put some else here.
But anyway,
before you say that part about the treatment, yeah, it's the fear. I'm gonna say it's fear first.
Well, I mean, I think it's related to who the person is, because a lot of men do get checked. I
Okay.
think that's an overstatement to say that men don't, but I think the majority of us just feel like I got it. Not necessarily that, I don't want the treatment. It's just, I don't trust doctors.
It plays into gender roles. It plays into masculinity supposed to always be strong, never being weak. It's about I'm the breadwinner. I'm supposed to take care of my family. I got to make sure everybody else is good to my detriment. And I think the biggest issue is more so when you feel something that doesn't feel normal to your body, being able to say, I'm going to the hospital.
Right,
The
go
next day when I got the numbers, I said, I'm going to the hospital. I went in, got my laptop, my bag, and I was like, I don't know how long I'm going to be here, but I'm going to go to the hospital. And a lot of men, like, I can work through it another day, or I can work through it another week. And you end up in a situation where you pass out. Now you scared your family, you've impacted your work situation, or you're going to be able to continue your job. So it's like getting out in front of that and being able to say, when I feel something, I'm going to do something about it. Like, your body. When it don't feel right, you got to go do something about that.
Yep.
So
again, going back to the
prostate checks, right? Prostate checks. What else do men need to?
I just want to say preventive care in general.
Okay.
Eddie, you made a good point, but I don't want men to wait until they feel something, because a lot of times if you wait until you feel something, there have been years of damage that a particular disease may have been doing to your body, i.e. prostate cancer and things like that. And we know that with a lot of diseases, the earlier you catch it, the better off the prognosis. So it's important to get your annual physicals. Everybody who is over the age of 18, we take our kids to their well visits. We need them too. That does not
because
stop.
they make us. Huh?
Exactly. Well, it's because they make us, right? Or they can't go to school and this and that.
So we need that.
I feel like we need that for our jobs. Like, you can't come on this job until you've had an annual physical from your provider.
Yeah.
Because you're a liability. You're a liability to your family. You're a liability to the workforce. Because there are people who are dropping dead at jobs and things like that because they've had high blood pressure, but nobody's checked it because they don't have a primary care provider. They haven't gone to the doctor. So preventive care is so important. Go to the doctor at least once a year, everybody.
All right. And you all are pharmacists. However, you are able to do way more than push pills. So if they want any of these screenings or need any of this information, they can come to you. And how can they do that?
Yeah, so they can visit our website, MedsPlusConsulting.com, MEDSPLUS Consulting.com. There's a contact us link on there. You can go to our social media pages, MedsPlus Consulting on all platforms, or you can call our office 205-650-4636.
All right. Yeah, it's been a great show.
Yes.
Great show. Diabetes, eating, food, Ozempic, what is it? Wegovy. That, Tylenol, and the different brand. We learned so much within 59 minutes. If you want to learn more, you can follow them and go check them out. The social media pages always popping. There's some information on there. They are very much in sync with their messaging and how it happens and making sure that it's relevant. And go check them out, MedsPlusConsulting.com, and then find them on social media as well. Y'all, we'll be back next Sunday. Maybe we like to go out of town in the summertime. We might be back. We may wait till Sunday after next, but we'll talk to y'all soon. Be vital.
Y'all ever make a video or written essay about an individual you know?
You said we might not.
Oh, we're doing it.
Show everyone that y'all did talk.